we have officially started. Thank you all for being here. This is the very first session of Healing Starts Here, and I'm very, very excited actually. And it is just so great to have you here with me. I really appreciate the support that you all have already given, and I think that this is going to be really good. So the other thing that I'll say is this session will maximum be 30 minutes. I'm hoping to keep it right around 20 minutes to respect everyone's time here. I know that everyone's busy, so just bear that in mind. This won't take too long. So I wanted to start with explaining why I am starting Healing Starts Here and what brought me to this program, I guess. And then afterwards, I'll explain what the program is going to look like logistically. So if you don't know me, my name's Sarah Brown. I was a traveler. I started my assignment in March during the pandemic and then have since signed on as full-time staff. So very exciting, glad to be at Swedish. And basically, my recognition for the need for this program started about as soon as I started nursing. So I became a nurse 5 years ago. I started out on a surgery, trauma, burn step-down unit, and it was a fairly intense unit, lots of turnover, lots of high acuity patients. So actually similar to our step down unit at First Hill, we were doing a lot of conscious sedation and procedural dressing changes and things like that. The patients, you'd admit a patient overnight from a surgery and then they'd go out to the floor or the ICU the next day. It was a fast-paced unit. So I ended up working there for about 2 years. Then after that, I transferred to the surgery, trauma, burn ICU and loved it, loved the ICU setting. That is definitely my passion and could not imagine myself doing another form of nursing at the bedside. So while I was in the ICU there, I had some things going on in my personal life that kind of led me to recognizing I need help. And so I went and started participating in counseling or therapy, whatever you prefer the term as, and found that to be really eye-opening. I didn't realize how much I expected of myself and how little grace or forgiveness that I gave to myself. And through that process of kind of working through my own pain and learning how to accept myself as I am, I figured out that actually changed the way that I practice. It affected who I was at work. It changed who I was, period, but it really changed the way I practice as a nurse as well. So, and all of that was driven by this idea that innately I chose to believe that I am valuable because I'm human, as opposed to the thinking that I was valuable because of the things that I was doing for other people. So all that to say, I came to this realization that caring for myself and valuing myself was not only okay, but actually necessary for me to really successfully cope with my job. I started to realize I wasn't the only one. I was recognizing that other nurses were feeling this way as well. And so I started doing my own research actually, and just, using Google Scholar and like nursing journals and a couple of medical journals, trying to dig into, okay, this seems pretty common. Like most every unit that I have worked on deals with this. So why hasn't anyone done any research on it? And as I started to read research articles, what I found is everyone's done research on it. This is a very talked about topic, and there's a lot of data to support different coping skills for this type of situation. You'll hear me refer to it as burnout. There's also compassion fatigue or moral distress, which are all different things, but all really, I think, a lot of what I was experiencing, and I think what we in the First Hill ICU are experiencing. So once I realized that there was this mountain of data to support nurses caring for themselves first before they come into work and care for others, my brain was so confused, because in my mind, we're supposed to be evidence-based, right? I thought medicine was evidence-based. So why aren't we doing anything to teach nurses how to care for themselves? I know for me, in nursing school, what I got was a PowerPoint slide, not a full PowerPoint, but a single slide that told me to exercise, sleep more, and I think the other one was like eat better. And I can remember it vividly. The title just said self-care, and that was it. And then the professor spent maybe 30 seconds talking about that. And I think what the message I heard was, you should really learn to deal with your own issues before you come into work, because you can't expect your patients to deal with your issues for you. So all that to say, I felt frustrated at this realization that these tools were out here, that we know that they're here and that they work, and yet I hadn't been provided those tools. So anywho, all that to say, I want to start providing those tools to the nurses here at Swedish First Hill. I think it's very important. It seems that it's highly needed, especially in light of 2020 and all that 2020 has been. So I have been working with several amazing people to start figuring out a way that we can start educating ourselves about how to care for ourselves outside of work. And again, my main vision for this is that everyone who participates will understand that they are innately valuable without having to say that, oh, because I'm a nurse, I'm important, or I'm valuable, or, oh, because I'm a nurse who does this, or I'm a nurse who adheres to the protocols, I am valuable. No, none of that. Because you are human, you are valuable. And that is the goal of this program, to help you understand that you are valuable and that you are worth being taken care of, first by yourself and then by the people in your life. So that's my vision for this program. And the way that it's going to look, it might change, but I have a framework for now. I have never done this before, so I am expecting it to be a lot of growing and a lot of learning. And generally, growing and learning include some uncomfortable transitions. So it might seem a little haphazard at times, or it might seem based that things are happening without a whole lot of experience related to those things, and that's accurate. I don't have a ton of experience in this, but I appreciate your patience with me as I'm growing and learning and figuring out how to best serve us nurses. So the logistics for this program is that there will be two educational sessions every single month. And I'm intending this program to last for at least as long as I am at Swedish, if not hopefully longer. I would like for this to be a long-term intervention. So there will be 2 sessions every month. Both will be virtually. I'm hoping that we can transition to in-person, but for now, both of these sessions will be virtually. One of them will be recorded. So you will be able to access the content from each session at a later point in time. If you work night shift, great. You can watch it at 3 a.m. when you're staying up for night shift. You will also be able to expect that recording to be published after the first session. The sessions will be hosted by me, but the people providing the content are much more experienced than I am as far as teaching nurses and teaching other people how to best support themselves and how to cope with difficult situations. So I'm pulling from our spiritual care department. I'm pulling from our palliative care department. I'm pulling a couple of nursing managers here and there. It's people who've done a lot of research and a lot of really good work on different topics like self-compassion, empathy, shame, communication styles, lots of different things that affect us both personally but also professionally at work. So the sessions will be like this one, 20 to 30 minutes maximum. I want to respect your time, and I know that days off are very, very precious. So we don't want to take off a ton of time, so it's just going to be 20 to 30 minutes. And the sessions will be at different times throughout the month, so hopefully it can work with your schedule. The other thing that I'll say is the speakers are going to be required to have their video on, and I am going to highly encourage that everyone who's participating in the video or the session would also have their video on. You can be muted during the presentation, but we really want to make this a safe place and a place that we can really feel like we're connecting, because this is something that we all are going through, and it's normal to feel this way, and it's better to, or maybe not better, but it is easier to understand that, oh, you're feeling what I'm feeling, when I can look at you and see, oh yeah, like their face looks sad or their face looks happy. So that's going to be one of the things related to these sessions. The other thing is I will communicate which session will be recorded. It will most likely be the first session every month. So if you don't want to be recorded, that's fine. If you're okay with that, then the first session will be a great place for you to meet if it works with your schedule. And like I said, if not, you can just watch the recording whenever you want. I'm trying to make sure that we've covered all of our bases. I'm going to have a couple of people who are on this call just kind of introduce themselves and explain their role. Right now we have Gretchen Covey and Greg Malone, who will be speakers, but they will also be contact points for you. Gretchen Covey is one of our amazing chaplains. Greg Malone is the director of the palliative care department. They're both amazing, amazing people who are very much in support of this program. And they will be presenting, but also they'll be present for these sessions as well. We'll have other chaplains and palliative care representatives as well, who, if at any point during a session, if you're feeling overwhelmed or like you need to talk to someone either during the session or after about what you're experiencing, that can be your contact person. I'll go ahead and ask Greg, if you can go ahead and just kind of introduce yourself very quickly. I know we're kind of coming up on the 30-minute mark, but yeah.
Yeah, sure. So, hi, folks. My name is Greg Malone, as Sarah said, and so I've been in Swedish now for 3 years. I actually did my chaplaincy residency at Swedish many years ago. Then I went off to go work in hospice for about 5 years as a chaplain. And then I went over to work on the palliative care team over at UW Medical. It was at UW Medical that I started to do a lot of workshops with medical staff, whether they were residents, whether they were fellows, a lot of nursing workshops. And a lot of the workshops were focused on self-care, were focused on kind of moral injury that can happen through the medical care you're providing, and just thinking through ways where one, not only can you bring all of who you are and be the amazing human being that you are, but also think through like how do you make the work sustainable? I mean, a lot of people got into the work because they love to do the work, and so part of what I'm excited about with Sarah asking for palliative care's participation is this is in our wheelhouse. This is what we do every day because of the kind of patients and families that we deal with every day. It's built into our team model of self-care and really thinking through ways that we're caring for ourselves, both collectively and individually. And so I'm very excited, and I look forward to sharing whatever wisdom maybe that I've had over the years and collected. But really, I think at the end of the day, I feel like the teacher is within each of us. And so what I'm hoping can happen in some of the sessions that I'll be leading is essentially calling on that wisdom within all of you to say, tell me what has worked for you in the past or what's not worked. And hopefully that can be a very human and normalizing space with all of us on the call together. So thank you.
Thanks so much, Greg. And then Gretchen, if you are able to introduce yourself and share a little bit of your support and your presence in this program as well.
Yes, I'm Gretchen, and I've been a chaplain here for 5 years, and before that I was a social worker. So, but I agree with everything Sarah and Greg has shared. I think this is a great place just to listen to one another, because I think in this busy and so much going on, sometimes we just need to pause and really listen. As Greg said, each one of us can find our way, but sometimes we just need a place to do that safely. So I hope to be a part of that journey for all of us, including me. So thank you.
Wonderful. Thank you so much, Gretchen. Yeah, and I couldn't agree with Gretchen more. This program is not anyone saying, "Oh, we figured it out. We're totally zen now working in healthcare." This is all of us coming together and saying, I could use some help. That's how I feel. And so I am very much excited about this, largely to just learn as much as I can. And I'm hoping that you all feel the same too. So I think that's about it. But I just, again, so appreciate all of you being present, and I'm excited to hear what you all are learning and any sort of interest in this. So I will say one more thing. I got an email about whether or not these classes are required. This is a totally voluntary program. You do not have to participate in this if you do not want to. It is simply to help each other grow and to support each other in our work. So thank you all for coming, and I appreciate it. I'm going to go ahead and stop recording, but I hope you all have a great day.
Thank